This is what's so cool. Now, it's an amazing, intricate network as well. But you'll notice spongy bone is made up of these tiny little beams of bone, and these beams are actually called trabeculae. And that's why sometimes spongy bone is also referred to as trabecular bone. But because there's little spaces between the trabeculae, blood vessels can actually weave in and out and get close enough to the cells that make up those little beams of bone. But you still keep in mind, all those beams of bone will still have collagen and hydroxyapatite. Now, something else that's extremely important within spongy bone is that also suspended in some of those spaces of spongy bone is red bone marrow. And what red bone marrow does is it produces your red blood cells, also known as erythrocytes, your white blood cells, also known as leukocytes, and your platelets, also known as thrombocytes. Most of us have a pretty good idea that red blood cells, their main job is to carry oxygen. White blood cells are about body defenses and immunity, and then platelets are about clotting the blood. So this is what's so cool. Not only are those blood vessels moving throughout the bone, the compact bone and the spongy bone, to supply nutrients for the bone itself, but it will also pass through that red bone marrow and pick up all those different types of blood cells and then take it out to distribute it throughout the rest of the body. Now, red bone marrow is distributed in specific places in the adult skeleton, mostly in the axial skeleton, which is the central skeleton, so like the skull, the spine, the sternum, the rib cage, and even the pelvic bones. And you can even see some in the proximal humerus as well as the proximal femur.